Dr. Robert Sweden, MD FACC, FABMR, Professor and Director, Institute for Natural Medicine and Prevention, presently the Dean of College, Perfect Health, USA, affiliated to Maharishi University of Management. Thank you.
Thank you. Namaskar. It's a great pleasure to be here at the World Ayurveda Congress here in Bangalore. Today I'd like to give a broad overview of Ayurveda, an expanded view of mind, body, and consciousness in Ayurveda. First, a theoretical model, and then empirical validation of this model. First, from the Charak Samhita Sutrasthana, you're all familiar with, the Ayurvedic students here. Ayus means the conjunction of body, sense, mind organs, and self, or Atma. And then mind, body, and self, or Atma, these three make a tripod on which the living stand. In mind and body, we all practice in our practices, in our clinics and hospitals, doshas, dhatus, agnis, malas. But very often we forget the mind in our practice. And very often we forget the Atma in our patients, the self or level of consciousness at the basis of the mind and body of our patients. However, modern science, and particularly modern physics, describes that at the basis of the laws of physiology or the laws of chemistry, the basis of the laws of chemistry or the laws of physics, as illustrated on the left-hand side of this chart. And at the basis of physics is a field called quantum physics, which describes those fundamental laws of nature, which are ultimately at the basis of human physiology and human health. And quantum physics describes one underlying field called the unified field of all the laws of nature, which is one complete total source, silent, but yet the basis or the potential of all the laws of nature governing human physiology and the whole universe. Modern science calls this the unified field of all the laws of nature. Ayurveda and Vedic science calls this Atma, or the self. And this is the missing link in many cases in our understanding of Ayurveda, how we can utilize this total potential of natural law at the basis of human health and master that level and create more perfection in health from that level. On the right-hand side of the chart, you see a description or a graphic of human awareness. And what happens during the meditative experience is that we start from an active thinking level, and particularly during this meditation called Transcendental Meditation, we experience quieter and quieter levels of the mind. And then we experience this quiet level of consciousness. Can something be done? Maybe we should wait a minute. During the meditative experience, particularly with this technique of transcendental meditation of Maharishi Mahesh Yogi, we experience quieter levels of the mind until we experience this unified field level on the basis of consciousness. Let's see if I can speak above this. Is this better? Can you hear better? Okay, good. If it's too loud, let me know. The main point I want to make here, as both from the point of view of modern science, modern physics, and Ayurveda, this unified field, or in Vedic language, Atma, is the common basis of the mind and body. And if we can enliven that level of mind and body from its source, then we can have complete mastery of human physiology. This is the source of the doshas, the source of the dhatus, and the source of physiology and health. And if we could manage the body, the mind, and even the environment from this basic level, then that is truly holistic health. Otherwise, we have partial values of health and partial results in our medicine. And this is the view of total health in Ayurveda: mind, body, and even the environment. We had this morning's session on public health, and we saw how necessary it is to take care of our community and our society, as well as the individual mental and physical domains. So let's review some technologies of mind, body, and environment in Ayurveda. This is research and applications, particularly done in the West. I'm going to show you some applications of these approaches to Ayurveda, particularly in Europe and the United States. And the examples of meditation I'll be using here will be Transcendental Meditation, as taught by Maharishi Mahesh Yogi, widely practiced in the West, and which is the most extensively evaluated method from a scientific point of view of meditation. This is a meta-analysis, a study of all the published literature on various meditations and relaxation approaches for their effects on blood pressure. And this shows that Transcendental Meditation lowers blood pressure as much as many drugs used, many allopathic drugs used in the treatment of hypertension, and that these effects are significantly greater than other forms of generic relaxation, stress management, and biofeedback. And this is the meditative experience of experiencing this level of pure consciousness, and these are physiological effects of that mind-body experience. A major risk factor for heart disease and diabetes is called insulin resistance. And this was a randomized controlled trial and done in Los Angeles. A study was published in the American Medical Association's journal showing that the practice of Transcendental Meditation improved both insulin and glucose in the blood without changing diet, drugs, or lifestyle, simply through this mind-body consciousness experience. And that has implications for prevention of diabetes and heart disease. In fact, a study of atherosclerosis by measuring the thickness of the arteries using ultrasound methods showed that individuals in this controlled clinical trial who practiced this meditation had an opening up of their arteries, a regression of their atherosclerosis, simply by enlivening this level of consciousness and orderliness in their physiology through this meditative practice. Finally, in the area of meditation, there's a very hot new study that just came out, presented at the American Heart Association, looking at rates of death, heart attack, and stroke in a randomized controlled trial in individuals who had heart disease, who were randomly allocated to practice Transcendental Meditation on the right, or to a control health education program on the left, receiving conventional modern approaches to diet and lifestyle, sort of conventional dinacharya, if you will, from an allopathic perspective. And on the right-hand side, you can see that those individuals practicing Vedic meditation, Ayurvedic meditation, Transcendental Meditation, had a 47% reduction in the rate of death, heart attack, and stroke over an average of 5 years compared to control individuals. Effectively, they lived significantly longer and disease-free. That was some of the mind approach of Ayurveda as practiced and validated in the West. Now I want to show you some highlights of research on some of the herbal medicines of Ayurveda, again used in the West and studied there. These are some compounds studied for their effects on antioxidant ability. Oxidative stress or free radicals are thought to contribute to aging and other chronic diseases like cancer and even heart disease. And Dr. Hari Sharma and colleagues at Ohio State University studied two very important Ayurvedic preparations, Rasayana preparations, called Maharshi Amrit Kalash number 4 and Maharshi Amrit Kalash number 5. They're complementary preparations, and compared them to modern antioxidants, vitamin C, vitamin E, and a drug called Propicol. And this graph shows the potency of those compounds. In this case, how potent they were in preventing oxidation or preventing free radicals. In this graph, you see that 1 gram of Maharshi Amrit Kalash 4, or 1 gram or 3 grams of Maharshi Amrit Kalash 5 were as potent as 10,000 grams of vitamin C, 27,000 grams of vitamin E, or 1,000 grams of the drug Propicol in having the same effect. So it was 10,000 times more effective than modern drugs or vitamins in this basis of so many chronic diseases. This is a slide showing the effects of this same herbal compound in vivo in patients in preventing their oxidation of LDL cholesterol, showing that Maharshi Amrit Kalash was significantly more effective than controls in patients. The last one was in test tubes, but a similar effect. In terms of clinical diseases, I'm using this as an example. This Rosina preparation reversed coronary heart disease as measured by angina pectoris in patients with heart disease compared to controls. That was just a sample of some herbal preparations in this broad overview. Now, Panchakarma has also come to the West and has been practiced in a number of clinics, and some flagship clinics are in Europe, in Germany, in Switzerland, Netherlands, and the United States, in these Maharshi Ayurveda centers. And there are practiced these classical Ayurvedic Panchakarma modalities, but a little bit differently or significantly differently that are commonly practiced with this consciousness basis. The goal and practice of these Panchakarma modalities are used in a way to wake up that silent level of consciousness, which is the body's own healing ability, using these physical procedures of Pittachili, Swedana, Shirodhara, Pidnaswedana, Basti. And here we've measured some of these physical health effects. You can see there are before and after these Panchakarma procedures done in the US. There are improvements in well-being, energy, strength and stamina, appetite and digestion, sleep patterns, mind and emotions, other physical complaints, and even measures of youthfulness. This slide didn't come out very well, but it shows reductions in cholesterol after 1 week of this Panchakarma program. And this slide also shows reductions in environmental toxins. One of the authors of this study, Dr. John Fagan, is in the room with us, and they measured these environmental contaminants which get into the blood of patients from pesticides and herbicides and other environmental contaminants, and showing that these Panchakarma procedures remove this form of ama, if you can say ama in Ayurvedic terms, but in modern terms you could say removal of these environmental toxicants which are measured biochemically. Now, mantra therapy is also well described in Ayurveda, and we can call that as sound therapy, often ignored in our Ayurvedic hospitals, but widely practiced in these Maharshi Ayurveda centers in the United States and Europe and other parts of the West. And we can call it Vedic sound therapy or Vedic vibration therapy, using these sounds of the Veda in order to have balancing effects on corresponding parts of the physiology to resonate with those deep laws of physics at the basis of physiology. This was a randomized controlled trial using this Ayurvedic sound therapy in people with arthritis, showing that there were significant improvements in both subjective and objective measures of arthritis using sound therapy alone as a technology of Ayurveda. Now, Vedic architecture is actually a part of Ayurveda. We can say we often forget that the quality of our buildings, the quality of our homes and offices actually contribute to the mental and physical health of the occupants. But this science of Sthapatya or Vedic architecture is actually described in Ayurveda as necessary for health. And I think many of the people here know that the scriptures describe the effects of the various directions, north, south, east, and west, and the effects of those directions and how a building should be oriented towards those different directions of Vastu. However, in the United States and other parts in modern scientific institutions have come to a physiological understanding of some of these ancient Vedic architecture descriptions and have found when brains face east or west or north or south, there are different brain wave patterns. So if you face east, then you have one brain wave pattern, but if you face south, there's another brain wave pattern. And this is very much consistent with the descriptions of Vedic architecture to have the main direction for a building or a house to face east towards the rising sun. And those neurophysiological patterns affect physiological patterns, which are necessary for ideal health. So even if you're eating the right food, if you're facing south when you're eating that right food, then you have these disorderly effects on your neurophysiology. Now a bit more about public health in Ayurveda and public health technologies described in Ayurveda. Charaka Samhita Vimanastan 3, chapter 3, verses 1 to 36, describe how stress in society leads to individual disease, leads to disease in the whole society, and eventually to epidemics. So collective stress leads to collective disease. And therefore, even from the point of view of Charak, reduction of social stress is necessary to create this state of complete health and ideal public health, which in turn feeds back to individual health. But how can we improve this level of collective stress? Modern public health is struggling to deal with individuals and has been relatively ineffective around the world, I would say. However, Ayurveda describes how collective practice of stress reduction modalities, in this case, this is an example of collective meditation using Transcendental Meditation and its advanced program called the Transcendental Meditation City Program, which is groups of people practicing meditation together, the square root of 1% of a population of a city, and how it's been shown through sociological research that the effects of this group meditation actually has a ripple effect on the level of the unified field which connects everyone in society, reduces the stress in the whole community, reduces disorderly behavior like crime rate and accident rates. And this study shows reduction in violent crime in Washington, D.C., where several thousand people were practicing this meditation program. So this is Ayurvedic public health, if you will. This is a summary of how Ayurveda can be expanded now to view it as not only an approach of body, herbs, panchakarma, dinacharya, diet, but including mind and consciousness-based technologies, including environment, which are all consciousness-based, and even the body approaches are ultimately based in enlivening consciousness at the basis of body, mind, and environment, described as the unified field in modern science. So we can say this Ayurveda can be now thought of in this more complete form as unified field-based medicine, a total approach to health. Thank you very much.